Hi everybody, welcome to Indigo Sky Holistic. I'm Davina Ketson, an intuitive holistic therapist, an energy healer, and a unschooling, deschooling mom of three. And I'm gonna talk a little bit today about pain, about physical pain, and what connection that has to our emotions, our mental health, our mental well-being. Reasons why I feel really deeply that this is an important subject to talk about, why it's dropped in for me today, why it feels like it's something that I want to discuss a little bit more. We'll see where this goes. This is a big subject, actually. It's one that's quite close to my heart because of my own pains, physical pains that I've seen reduced through emotional healing and energy healing, through emotional clearing. And it's like there isn't a day goes by where on some post somewhere or on some Facebook group or somewhere in like a news item or something, there isn't some discussion on long-term pain for people, chronic pain conditions, and how people are looking for ways to support their reduction in that pain management. And one thing that I don't think gets discussed, hardly at all, I do see it discussed, but on a really small scale, that I think could really, really benefit a lot of people a lot more, is the impact stored emotions have on physical pain. So, to give a little bit of background, I worked for 10 years in healthcare, residential care, care in the community, residential care, nursing care, and then the NHS, the UK's NHS in hospitals. And when you're working in residential homes and care homes, oftentimes staff numbers are quite low, moving and handling isn't quite as it should be because the staff numbers are not there. And I'm talking about this because one of the most common problems that many care workers have is back pain. And that is what I had. And I'd also been in a minor car accident as well, when I was about 24, I think, maybe 23. I was shunted. Someone hit the back of my car and shunted me forward into the car in front, and that did have like some whiplash and back issues following that. And obviously then I also had babies, and all of these things I put down to a really significant back pain issue that by the time I was about 33 was massively recurring for me. It happened the first time when my second baby was about 6-7 months old. I went to pick her up to put her in the sling, and my back, like lower back, right at the lower, right in my lower spine, just went completely. I was like crippled, couldn't actually pick her up. Shouted for my husband to come help, and that was the first significant flare up of it that resulted in my like feeling like I couldn't move for a few days, like really struggling. The pain was shocking. I was at this point not opposed to pain relief. I used a lot of ibuprofen and paracetamol and some codeine, knowing that if I went to the doctors, they'd do scans. I'd had scans in the past. I had scans following my car accident to assess like any long-term damage. I also knew from having worked in healthcare for a long time that if I went to the doctors, they'd be like, yeah, we can do this, we can do that, but they'd just give me pain relief. And I really didn't want to be on like massive doses of all the weird and wonderful medications that they give for pain relief. I was aware of a lot of them. I didn't want to go near them whilst I was still not in a more holistic, naturopathic way of choosing to care for medical scenarios within the family. I wasn't going to go and get some of the really massively strong painkillers, or, you know, they'll put you on antidepressants for pain relief. You're like, you know, I've got pain, I'm not depressed. Although pain can clearly impact your emotions and make you depressed. So I, at that point, found a concoction courtesy of a friend. I went to visit a friend on another occasion when the pain had flared up. And I think it was a relative of hers who suggested Panadol Extra, so that's paracetamol with caffeine in. And I researched this and I was like, oh, the caffeine actually boosts the paracetamol and helps paracetamol do its job better. And then I could alternate between the ibuprofen and the paracetamol Extra. I'm trying to think what the non-brand name is for it. The paracetamol Extra, the ibuprofen, I think I might have had at the time like the double strength ibuprofen as well, that you get on prescription, but I happen to have some from a friend. And I found this concoction that just took the edge off. But what I noticed was it never made it go away. No amount of the pain relief that I took made it go away. And all the time I'm aware that ibuprofen isn't good for my asthma. I'm aware of the side effects on the stomach if you take a lot of painkillers. I avoided codeine if I possibly could, because first of all, it didn't really do anything for the pain, but also it does make me kind of high. And I didn't want to be, like, I'd got 2 small children. I didn't want to be like taking massive amounts of really strong painkillers. And over the following, about 4 years, 5, 6 years, this pain would start like with just like sudden spasm in the bottom of my back that just like, whoa, I wouldn't necessarily be doing anything. It would just hit me. I still can't now pinpoint what was going on for me emotionally or mentally at the time where it would hit either. Potentially it was because I might have looked at the bank account, or might have, just going off what I know was causing it further down the line, it might have been that some money hadn't got paid in. It might have been that I was like feeling overwhelmed with work. I was self-employed. I had a handmade Etsy shop at the time, which was quite time consuming and a lot of exchanging time for money type of hand crafting, and not really charging my worth for that as well. And this pain would like hit me in the bottom of my back, and then I'd be a week or more where I just literally couldn't move through that pain. And then over the course of a week, 2 weeks, 3 weeks, the pain would, I describe it as like moving up my spine. It'd start off there and then it'd move a little bit further up, and then it would like work its way up to my neck, and then I would feel like my head, not in a painful way, but in a way now that I know as energy, like where I'd feel all these energetic sensations in through the back of my head and through the top of my head, and it would like literally pop out the top of my head. And that part of it would only take a short period of time to release and move. And that I began, as I then began to look at like more holistic approaches to healthcare generally, as I began to dive into meditation and mindfulness practices, I began to realize that was in fact what it was. It was energy moving up my spine until it got released from my head. It was still another couple of years before I found the thing that resolved the pain, and now 5 years on, I've never had that recurring scenario occur again. And the cure, because obviously I'm not allowed to call it a cure, and just, proviso here, I'm not a medical professional, I'm not a doctor, I am not medically qualified, I am a holistic therapist and a holistic practitioner and an energy healer, and this is my own experience with it, and this is how I support people through my practices, through their healing journey. And I do not suggest for 1 minute that people stop taking medication to choose this instead. I do suggest that people use both at the same time and see if there's an improvement in things, discuss with their physician, reducing, changing any medication as things feel better emotionally, mentally, and spiritually. So I did this in 2019. I did this energy clearing, emotional clearing practice, which released emotions through my energy centers, through the 7 energy centers, the 7 chakra system that's used in a lot of modalities, healing modalities and spiritual teachings. There are more than that, way more chakras than that in the body. There are way more energy centers than that in the body. If you go into and exploring Hindu tradition, which is where the idea of the chakra system as it's taught comes from, there's a lot more. We have energy centers all around our body, and they're helping the energy move through the body. I myself teach 22 energy centers and support people through 22 energy centers. I think those 22 energy centers are much more activated now when I hear people's stories, particularly around physical elements in the body, physical conditions and aspects in their body. I can see where the energy is sticking in those parts of the body and where they're experiencing pain. Interestingly, I think a lot of the within, I think it's fibromyalgia, where there are points on the body that feel pain to touch. I know that my dad was diagnosed with fibromyalgia many years ago now, and I remember my mum reading about this, and testing him on these points on his body, and those points on the body, a lot of them coincide with where energy centers are within the body. So as I went through this process in 2019, I was doing it to try and get clarity on this handmade business, which I'd had for about 6 years at the time, maybe 7 years, which I was after expanding and growing, but not exhausting myself doing. I had no intention of coming out of that process declaring myself a healer, realizing that healing was my sole purpose, that was my life path, that was what I was here to do. Didn't have go in with any idea of that. But what came through from that was that when I was talking to the coach and therapist that was taking me through the process about the crystal healing and aromatherapy that I was doing at the time, and when I talked about healing and health, that was when I actually got quite inspired and lit up. And I did have this big dream of a holistic therapy centre. Crazy, because I am actually in a holistic therapy centre now, but where I was still keeping my focus on this knitting and crochet, teaching it, using that to support people's mental health, teaching it online, and having big classes and workshops, and literally was not my purpose. It was not my passion. Whilst I was going through this healing process, I was developing an online tutoring service for that. Took on my first client doing that while doing the healing process and everything, and was like, this is it, so doing it. No. By the time we got to the heart and throat center and then the third eye, I was like, oh, I'm oh no, this is not what I'm supposed to be doing. I am a healer. I am here to support people with the holistic therapies, which I've fallen in love with, which I'm learning about, and which I'm doing. All of that suddenly, round about week 4 of the 8-week process, the pain that I'd had in my back at the start disappeared, as it does. And it was only about 6 to 12 months later, penny dropped. I'd not had the pain again. It had never resurfaced again. It's not to say I haven't had some other recurring back issues last year, but they were up here, which is a very interesting thing for me to maybe talk about another time. But this energy that kept coming and getting stuck in my root and sacral energy centers was all around insecurity, trust, fear of survival mechanism, fear of like how I was going to manage and survive in the current scenario and the situation that I was in. And as I'd cleared these emotions through those energy centers, there was no stuck emotions there anymore. And that's not to say that I don't sometimes feel a bit stuck in survival, and that's not to say that I don't have issues sometimes with fear and anxiety and worry surfacing for me. They do, but because those energy centers, because I released at that time the depth of those emotions through those centers, the emotions are not stuck. And because of my own processes that I then use on top of that since, the energy just doesn't get stuck there. I find the ways, I have the tools to release and clear that energy consistently and appropriately and completely. So what I feel is neglected to be discussed with people, this is why for all it's great for certain things like trauma, if you're in an RTA, you're going to want to go to A&E. There is a lack of a holistic approach to emotional and spiritual health. And the approach to mental health is, let's put you on antidepressants, that's the solution. Or we'll put you on a waiting list for a counsellor. You might get to see a counsellor in like 12 months, and the counsellor isn't necessarily offering a like individualized support setting because they like ticking boxes, and unless you go and see a private counsellor or you go and see a holistic counsellor, then you're not necessarily getting supported with these other things in your life. And if you go to the doctor with pain, how many times is he going to say, well, what's your emotional state like? What's going on for you at the moment in your life? What's your money situation like? What's your employment situation like? What's your relationships like? What's your self-worth like? Very few, and this isn't necessarily because they don't know it, it's potentially because they're overworked and have got like 20 minutes to talk to you and don't have an hour to have a consultation with you and like discuss your whole life history to find out what's the root cause of this pain that you've got going on. And they're certainly not necessarily versed in Eastern modalities around like which energy center is this. And very few places here in the UK where people are getting free at point of service healthcare are going to offer and refer acupuncture or homeopathy or stuff like that. I'm not sure even where that is now within the NHS. I know aside from being pregnant, the last time I was in surgery with like a GP surgery, not like operation surgery, with GPs, I was actually in a GP surgery once, registered with a GP surgery once, where they did do acupuncture, which was really, really cool. I never needed it, and I went privately to go and see someone about my asthma with acupuncture. But there isn't enough of that holistic approach to healthcare that I think is really what is creating a lot of the physical elements of health conditions that are literally overrunning our health service here in the UK. There's something like some crazy high percentage of people who have chronic back pain and are just on pain relief for it, and nobody's ever going in to discuss with them what's your emotional state, what's your life situation as a big picture, so that it can be pinpointed. And a lot of people will actually think it's a crazy idea. Well, go and see a Reiki healer and see if they can help you support this energy shifting. And because people want a quick fix, and pain relief can often be that quick fix, and sometimes you might need to see a Reiki healer 5, 6, 7, 10 times to actually go, oh yeah, actually it's gone. The difference is it might take like 3 months of seeing a Reiki healer, or 3 months of emotional clearing, processing, or 3 months of some other holistic support, even if it's massage or physiotherapy, to do that. But the potential is you won't need to have it done again. Like I paid £1,000 for this emotional clearing process, but I've never had to pay that out again to do the same thing, because it was a complete clearing of that energy system. Free me up for more awareness of what further steps I needed to take for my whole well-being. So that's my little bit today, is if you have exhausted ways and means of looking at a cause for your physical pain, or if you have chronic physical pain, I know how hard it is to look at the emotional trauma. I know it is. Nobody wants to go there. Nobody wants to look at the past. If it's like really deep wounding, if it's really traumatic events in youth, in young adulthood, if it's something that's happened, if it's the sort of scenario that has really caused trauma from some sort of abuse, some sort of violence, some sort of attack of some sort, then I get it. Like, no, nobody wants to go there. But if you're suffering chronic pain and you have a history of some event having occurred younger in life, or recurring abuse, maybe child abuse, maybe when you were younger, and that's not been addressed, it might be worth just finding somewhere that can be addressed, to see if, don't necessarily get rid of your chronic pain, that's not necessarily what we're talking about, but if you could vastly improve your chronic pain so that life is easier to cope with, then isn't it worth the investment? What price can you put on being able to live your life in a more energized, happier, pain-free or pain-reduced way? Like, what price would you put on that? It cost me £1,000, like, to do the process that I went through. It wouldn't necessarily cost £1,000 to go through a process where you get support. It certainly won't cost anyone £1,000 to see me for 3 months as a Reiki practitioner. Some of the other things that I do, if you wanted more personalised one-to-one, day-to-day support and coaching through a traumatic event, then that's obviously a vastly different support process. And there's there are therapists, healers, support networks, people out there at all price points, for all budgets, that can support and help you. I have a free EFT video for pain. I'm going to do one in my paid section of my website, my paid for library on my website for pain, because I've found it so beneficial myself to do emotional clearing, so EFT is the main one that I would use just for free content and free support. And there are other YouTube videos out there and support from different things that are like small payments to be made, different places that offer that. But that's something that I think is neglected to be mentioned by many healthcare professionals, either because it's not something that they've looked at themselves, or because they're dismissive of energy healing and Eastern medicine, philosophies, teachings, spirituality. But all of that is like, if you were in chronic pain, exhausting your options could vastly change your life. Like going through all the options, choosing to see a Reiki practitioner every week for 3 months, choosing to see an acupuncturist every week, every fortnight, once a month for 6 months, choosing to get some other means of energetic, emotional support, even a massage. Even going and having a massage once a month could vastly change the way that your energy is flowing, the way your lymph system is working, which can cause a lot of problems with like painful joints and muscle areas, all of those things. And if you could ease something to the point where medication isn't necessary, or medication is vastly reduced, or where it goes altogether, like, it's just a thing to be put out there. And I see all the time, every day, somebody complaining of pain that they've been to the doctor for, that's inexplicable, that's being labelled as something just to like be able to just like tick it off as a right, yeah, that's what's wrong with you, and there's nothing we can do about it, and here's have some painkillers. There might be nothing that a doctor can do. There might be something a holistic therapist, a practitioner, or energy healer could do. So keep your options open, explore the possibilities. If you'd like to, I will link my EFT for pain video, and if you'd like to explore it using any of the modalities that I use, you can book a intuitive consultation. I'll put that link down in the comments. Meanwhile, I do wish you the best of health and wellness on your journey. Remember, you are more than just your physical body. You are spirit, you are soul, you are light, you are all these things. You are powerful, and you have choices to change your life at any given moment. Thank you for listening. Please do all the magical things that YouTube likes you to do. Like, comment, subscribe, drop me a message, a comment, and let me know what you think of this. Have you found a solution to chronic pain using some sort of alternative means other than modern medicine? Or have you got chronic pain that you're struggling with, and maybe there's some ideas out there that could support or help you? And I'll see you again very soon. Bye.